So today we're going to be talking about the unfortunate topic of medical racism. Now, this video was going to be published a few weeks ago, but because of a lot of stuff behind the scenes, I couldn't get it out. Nonetheless, this is a very important topic to talk about because when we talk about the pandemic and when you talk about vaccine hesitancy, mistrust in the government and different institutions in our nation, this is the reason why a lot of Black and brown folks don't trust the ops or the federal government. Now, let's forget all about that and talk about what is medical racism. Medical racism is the systematic and widespread racism against people of color within the medical system, such as, medical experimentation, the health disparities in health coverage by race, as well as the biases faced by healthcare workers against people of color within their care. Today, we're going to be talking about medical experimentation, as that has a long and very egregious history within the American system when we talk about slavery. Now, why was medical racism very prominent during slavery, especially when you talk about how slaves were often used for just labor, not necessarily seen as test subjects? There's a lot of reasons. For one, under the shadow slavery system in the US, slaves were seen as property, and that still rings true when we talk about medical experimentation, because a lot of doctors and overseers saw slaves as property to be used as experiments. In that sense, when we talk about the interest between the physicians and the slave masters, basically the slave masters wanted to give enough care for the slaves to be able to continue to do the work that they need to do in the field. For physicians, slaves were seen as a consistent line of work, just as many physicians, whenever you do a partnership with a business, see their employees as a consistent line of work, because health is one of those things that will get worse and worse as you age, especially when you work in blue collar work, aka back in the day whenever slaves were in the field, slaves were doing the housework, slaves were doing all that back-breaking work day in, day out, 24/7, 365. That's a consistent line of work that physicians were able to do to keep themselves employed. Not only were they getting paid to take care of slaves, many physicians actually bought slaves for the purpose of using them for their own experiments. And for some of the examples I'm about to use later on in the video, that was the case for their slaves, basically using these slaves as guinea pigs to make sure that everything be all right before they really adopt all this medicine towards their, society. Not only were slaves seen as property, but also they were more likely to suffer from, respiratory diseases as well as many other ailments because of the conditions that they were in. Even slaves had a quote unquote nice master who would make sure they were taken care of, make sure they were fed well and all that. They were still put in lackluster slave shacks that basically couldn't really protect them from the elements, whether it be the heat in the summer or in the dreaded cold of the winters. And keep in mind too, a lot of the operations done onto many people, especially slaves, weren't done in the cleanest of environments, especially in the 1800s, because that was before the discovery of many different, germs and their connection to infection. For a slave need to be operated on, it was often done in quote unquote slave hospitals, basically more upgraded versions of slave shacks, but didn't really, protect, slaves from microbes, from bacteria and all that, because not only were they the filthiest environments, also there was no sterilizing, there was no antibiotics, as well as there was no nightgown and all that. Basically, they operated in their street clothes and didn't really clean up their hands or their whole, body whenever they're operating on, their subject. But one of the most staggering ideas that came out of the antebellum South was the idea that Negro medicine was a separate classification to white medicine. This idea came from polygeneticists. Now, if you don't know what that means, it means that professionals took the idea that races, came from different, evolutionary pathways. For example, white people came from a different evolutionary pathway than, Black people. And we're not on the same, tree, meaning that we don't have the same genes, we don't have the same, biology. Basically, we are different species from each other. One of the big practitioners in this space was Samuel A. Cartwright, who wrote a book called The Diseases and Peculiarities of the Negro Race. The basis of this book basically said, hey, Black people have different diseases than white people. They suffer from different ailments. One idea that he wrote about and he stood by vividly was the idea of drapetomania, coming from the Greek words of flight and insanity. He's basically saying that the need for a slave to escape or, to get away from slavery, to break their chains, was a mental health disorder. Sadly enough, Cartwright prescribed that slaves be, sent to internment camps They have to work in the field all day. Basically, they need to put through corporal punishment, saying that they need a little bit of exercise to be held under their master's thumbs to cooperate more into their work. The narrative that Cartwright created with the thought that there's specific Black, mental health disorders, or there's specific Black ailments plaguing the Black community keeps happening in today's, society, especially when you talk about the different talking points between crime in the Black community as well as crime in the white community. Because oftentimes crime in the white community is seen like, oh, they're having a mental health issue, oh, something going on with the parenting, we need to fix that. But when we talk about the same type of crime, especially when we talk about, violent, basically it's more of just like, oh, Black people are just like this, it's in their culture, it's in their genes, they need to be locked up. These are the same talking points that, Cartwright had. That was the foundation of his book. And while Negro Medicine deserves its own video by itself, we still need to talk about a lot of other atrocities that happen in the name of medicine. I'm gonna talk about is James Marion Sims. Now, if that name sounds familiar, he is basically the father of gynecology, as well as he's the main subject of this picture, which is currently owned by Pfizer. He pretty much is seen examining a slave woman and, in a room full of his peers. While that picture seems very tamed, it is actually far from the actual reality of, how he treated his quote unquote subject. His career, where he worked on the plantations of Alabama, he basically came across neonatal tetanus. Neonatal tetanus is an illness that is pretty much caused by the exposure of wounds to animal manure. The reason it got its name is because oftentimes when it affects newborns, it basically will affect them through their umbilical cord wound that was still healing after birth. This disease was highly infectious among, slave mothers as well as their children. Oftentimes slave quarters were located near the horse stalls, where manure happened, as well as far away as possible from the master house, because they didn't want, slaves to be in such close range of their, masters. Due to the fact that slave doctors didn't really, know anything about sterilization or washing their hands, then you understand why so many, African-American children were unalive because of this. But just like many doctors will blame parents for the diseases of the children, not the environmental condition that they were in, basically Sims did the same thing by saying that, oh, slave mothers, they don't know how to take care of their children, they're incapable, they're disgusting, they're, basically dumb, and that, we need to do something about this. We need to help them because they don't know what they're doing. The main things that Sims became well known for was his work in viscovaginal fistula. Again, too graphic, it's basically the eroding and the opening of a woman's area along with the bladder as well as rectum. Now, this complication was very much a concern for not just Black women, but also for white women in the antebellum South. But pretty much Black women suffer from this at a higher rate. This oftentimes happened in malnourished individuals. And when you talk about slavery, slaves were often malnourished to the point where they, fainted in the fields. One thing many physicians at the time were worried about or considering was the deficiency in vitamin D, and that malnutrition in that caused a lot of bone effects. But instead of just studying the malnutrition part of it, Sims decided to actually experiment upon torn genitalia of slave women. This led to Sims actually acquiring 11 women, Black women, between 1945 to 1949 to do actual experiments on them. And when I tell you this is one of the most dehumanizing processes, then you understand why, Black women are often, disrespected and often highly sexualized, especially in the media. Because the antebellum South existed in the same time period as the Victorian era in England. During the Victorian era, it was very frowned upon for physicians to see, unclothed women, even if they were doing an operating procedure on them, because of, their dignity. It was even common practice for doctors to not directly look at a woman's, region, rather than to just rely on their sense of touch, because it was such a frowned upon practice. But obviously this same courtesy wasn't extended to many of his subjects who were Black women, because not only would they make them unclothed, get on their hands and knees and all that, but basically he would have this special device that will open up her region in full view of the entire room, people in it. And the sad fact about this became actually a spectacle, as many physicians, as seen in the Pfizer image, basically they would just come all around Montgomery. Local apprentices would come and see, basically trying to see what was a hubbub about. and basically treated them not as just like women who needed decency and respect, but mainly as property. The phenomenon that he was trying to study and, find a cure for required a very, very dangerous surgery that he had to open up a lot of tissue within that region, but he actually sutured it up. And like I said, many, many physicians didn't have, sterilization. They know anything about bacteria or diseases. So oftentimes these sutures become infected, and this required him to open back up continuously. And don't get me wrong, it wasn't like there was no anesthesia back in that time, because as early as the 1840s, there were known anesthesias that he could have used to help these women as well as these girls so that they wouldn't be able to feel this type of pain continuously. But at the end of the day, he refused to give it because he felt like the surgery wasn't painful enough. But yeah, a few years later, in the same county in Montgomery, Alabama, basically he was readily able to use the anesthesia all of a sudden for white women. As you can already tell by the comparison I'm making, many white physicians, especially back in the day and even to now, think Black people tolerate pain in a different, regard than what white people can, meaning that we have a higher pain tolerance even for the most excruciating of surgeries. And also keep in mind, a lot of these women were actually young girls, because during that time period, women would have children very, very young, even in their teens. And when you think about enslaved women having, children 3 years earlier than what white women had, these were very much young women that were often the victim of the R word and had to bear the scars of that experience by having the children. And quoting from the book, A Medical Apartheid, which is a great book, y'all need to pick this up. He referred to a slave, by the name of Lucy. And basically he said that was before the days of anesthetics, in referring to the surgery. And the poor girl on her knees bore the operation with such great heroism and bravery. Like, this girl was in agonizing pain that I can only imagine from a dude's perspective. And it's literally, just saying that, oh, she was brave, she was strong. It's like some of the same rhetoric that we often use whenever Black people go through great pains, whether it be through racism, medical racism as it is now, discrimination, prejudice, whatever. Basically, we often refer to, people who stand up and fight for their rights, especially the civil rights movement at that, as strong. My main thing of this whole thing is that they didn't need to be in that situation to begin with. And going from there, not only did he operate women oftentimes without anesthesia, but even after the fact, he will hook them on morphine. Basically, he will give quote unquote large doses of morphine 2 times at 24 hours after the surgery, in order for them to calm their nerves, in order for them to forget about the pain, or for them to, just not really try to resist, because he still needed these women to perform more operations. He was able to perform the vesicovaginal fistula surgeries in May 1949 after going through years and years of operations on a lot of these women. Noted in the book that one of the women, her name was Anarcha, basically she went through more than 30 operations alone to try and perfect his technique that made him a national name. In the early 1850s, he decided to move to New York to open up his own practice to teach medicine, to continue to operate on Black women as well as immigrant women. He then founded New York's Women's Hospital, the first women's hospital in the nation, in 1862. His fame even got him into royal circles, as he was a very much esteemed guest in French society. And at the time of the book being released in the early 2000s, basically the author did say that vesicovaginal fistula was a common ailment seen in sub-Saharan African women who had the same risk factors as enslaved women during the time that Sims did his experiments, which were malnutrition as well as not having, the cleanest, medical care during their childbirth and surgeries. Just like many things in history, a lot of these atrocities are covered up because not only does, people want to silence Black women, especially, when they talk about the harms that white society has perpetuated onto them, but people don't want to be held accountable. And it's just, Sims need to be held accountable for his atrocities because, he did some effed up things, beyond what he did to these women. And I think their story needs to be told more. What's up, y'all? This is Post-Production Lawrence. Basically, I had a lot more stories for this video, as well as, discussing, the eugenics experiments that took place in the US in the 1900s. But during recording, my mic actually died mid-video, and obviously I couldn't put that in video. This video just touches the iceberg about the medical issues we have in this type of space, And so this is going to be a continuing series. I'll be posting more commentary videos about in the future, and it's just one of those things where it's just like we'll be going deeper down a rabbit hole. Now, if you like what we see today, please like, subscribe, turn on post notifications, a lot of wonderful good stuff. I appreciate y'all coming to the end of the video. While you're here, please go watch my other commentary videos right here, as well as, you know, support the channel in any ways you possible. Stay warm, stay frosty, depending on what part of the country you're in, and peace out.